So a study just came out in Journal of American College of Cardiology, one of the journal for cardiology in the United States. And honestly, it is absolutely horrifying. On one hand, I should be happy because it confirms what I have been seeing and our team had been seeing at the holistic heart centers, specifically that genetic vulnerability is key. And what we're doing in cardiology right now is assessing our risk all wrong. We're relying on these decades-old equations that continue to hammer down the population level risk with some variations. They get revised, they get re-edited, new things get added in, but these population level metrics are just not good enough for predicting a disease process which is lifelong in a specific individual. And most importantly, these type of equations are really underestimating disease burden and risk in younger people and in women. So the study that came out was done at Mass General Brigham. And one of the cardiologists that I personally know, Dr. Akil Fahed, that we taught a precision genetics course some time ago, was one of the authors on this study. So what they did find is that they looked at patients who were screened in terms of their genetic makeup, and they zeroed in on patients who were the top 20% of risk based on the genetic data. So we use a very similar approach to the holistic heart centers. We zoom in on the pathway-specific genetic risk. And so they invited those patients to actually come and have a cardiac CT angiogram to look for evidence of coronary artery disease. And the shocking thing is that they found that these individuals, and most of them were fairly young, mean age was in their 50s, 50% had plaques. Most of these plaques were non-calcified, and almost 30% of these plaques were high feature risk plaques. So high risk plaques that are capable of rupturing and giving a person a heart attack. And so the authors, and thank you, Akil, for putting this study together. It's sort of a preliminary report. They actually hadn't finished the study, are advocating for genetics first. And I want you to know this is exactly the reason why I built Heartwell.ai, and this is why 100 plus genetic tests later, I can tell you that if you don't know your genetic makeup, you have no idea what your cardiovascular risk is. And hopefully you understand that the heart risk is the longevity risk, and longevity is vascular. So go get your genetics done so that you don't get caught with a high risk plaque.